four groups mainly, four categories. What are those four categories? So first one is rapid acting insulin preparations. They are also called as ultra short acting. Please remember, they are also called as ultra short acting insulins. So next group we have short acting insulins. So we are talking about insulin classification. So short acting insulins. The third group we have intermediate acting insulin preparations, and fourth group we have a ultra long acting insulin preparations. So let us see what are all the rapid acting insulin preparations we have. So under rapid acting, you need to remember three drugs mainly. LAG. One is insulin, Lispro, insulin, aspart, and third you have got the insulin glulicin. And next let us see what are all the short acting ones. Here you have a regular insulin as well as the semi-lente. Insulin preparations. Under intermediate acting you have neutral protamine hegedron as well as the lente. Under the ultra long acting, you have got a very important drug, that is DDG. You have Ditimer, you have Glargine, and a very important drug, that is Degludec. And one more preparation you have is the ultra lente. So you have this rapid acting preparations, short acting preparations, intermediate acting preparations, and the ultra long acting preparations. So let us see their onset of action. So next let us see their onset of action. So here the onset of action will take place somewhere around 15 minutes to 30 minutes, whereas short acting, here it takes around 30 to 60 minutes, whereas the intermediate acting will take around 2 hours, whereas the long acting preparations will take around 4 to 6 hours to produce their on action initially. So what will be the duration of action? So if you consider the duration of action, so please remember duration of action. So duration of action, so the rapid acting insulin preparations will act for 3 to 4 hours, and next these short acting preparations will act somewhere around 6 to 8 hours, and intermediate acting preparations will act for 16 to 18 hours, whereas the ultra long acting preparations will act somewhere around 20 to 40 hours. So that's why they are called as ultra long acting preparations. So as you can see here, one of the important thing which you should remember is degludec will act for this will act for 40 hours, up to 40 hours. So which is called as peakless insulin. So ultra long acting preparations, they are also called as peakless insulin preparations. So in your exams, if they ask about peakless insulin preparations, so please remember to write these examples. So those insulins which are having a ultra long acting actions. So just to recapitulate again, so please remember we have 4 categories of insulin classifications. So we have a rapid acting, which is also called as ultra short acting preparations, short acting preparations, intermediate acting preparations, and ultra long acting preparations based on the duration of action. Under, if they ask about rapid acting preparations, please remember the lag as a mnemonic. L stands for Lispro, A aspart, and glulysin. Under short acting, you have a regular insulin and semilente. Under intermediate, you have a NPH, neutral protamine hegedrine, as well as the lente. And ultra long acting preparation, which are also called as peakless insulin, we have a degludec, ditimer, glargine, and the ultra lente. So the onset of action of rapid acting will be around 15 to 30. So how to remember this? So please remember, just you need to double the minutes. So rapid acting preparations, you have 15 to 30 minutes. What will be the double of it? It will be 30 to 60 minutes under short acting. So if you double the 60 minutes means 1 hour. So if you double the 1 hour, you will get a 2 hours here, 2 hours. So intermediate acting. If you double 2 hours, you will get a 4 to 6 hours here. So very easy to remember. 15 to 30, 30 to 60, 2 hours, and 4 to 6 hours. Even the duration of action is very easy to remember. So please remember, the rapid acting insulin preparations will act for a duration of 3 to 4 hours. So you double it next. So 3 to 4 hours means, so it will be around 8 hours if you double. So 3 to 4 hours, next is 6 to 8 hours. So if you add 1 to it, it will become an intermediate acting duration of action to the above duration of action, that is 16 to 18 hours, and above that is the ultra long acting preparation, that is 20 to 40 hours. So hope this will be useful for you in terms of preparation as well as the structuring of your answers in your MBBS theory exams, as well as this is very important from the point of MCQs also. They may ask about, so which of the following is the rapid acting preparation? So you need to know this table. So they may ask which is the peakless insulin among this, and which is the drug which acts for 40 hours. So it is the degludec. And which is the drug which is given in case of the which is given particularly through IV route. It is your regular insulin. So all the insulins are given through subcutaneous route, whereas the regular insulin is given through intravenous route in the treatment of diabetic ketoacidosis. Hope this will help you in terms of fetching more marks in your exam. So this completes your insulin classification.